as well as an overview of the primary challenges of implementing the fiscal year 22 budget and beyond, and try to answer some of your questions and comments. We won't be going into any specifics on programs themselves, but the overview of the financing. If you have any questions or comments, please enter them into the question box, and we have some moderators who will be planning to transition those forward to me. As we begin with the fiscal year 2021 overview, and our fiscal year runs from September 1st through August 31st, so we are now in the last quarter of our fiscal year. I just want to take a moment first to thank everybody for all their efforts during the pandemic and the winter storm, among other challenges that have been approached and addressed with all of us, from clients and families to advocates to the staff. Everybody has really done an exceptional job in being able to transition during this period so that we can try to keep the supports moving for the individuals that we're serving. As a high-level overview of our funding sources, and we'll break each of these down more individually in just a moment. The Texas Health and Human Services Commission provides a little over $40 million of our current $116 million budget. So a little bit over a third of our budget comes in contracts with the state. There's another $16 million, about 14%, that comes through the 1115 waiver. And this is through delivery system reform incentive payments, which we have to meet certain measures in order to draw down those payments. Later on in the presentation, we'll go through how that financing is going to be changing in the upcoming years. We only receive about 11.7 million or 10% of our income from insurance and client billings. This is due to only about 40% of the individuals that we serve having insurance coverage, with the primary coverage source being in Medicaid or Medicaid managed care. Central Health and Community Care Collaborative provide about 8.4 million or 7% of the budget. That is primarily for inpatient services for individuals that are indigent. The City of Austin does a little over $11 million in annual funding at this point, which is about 9.6% of the budget. And Travis County at 7.5 million or about 6.5% of the budget. We are very fortunate here in Austin to have the community collaborators with the Community Care Collaborative, City of Austin, and Travis County to work with us in supplying these services as we move forward. There are a lot of centers within the state that do not have such good relations or financing and working on filling the gaps of services within the community with the local funders. There's a little over 6 million in other federal funding. A lot of that is direct Substance Abuse and Mental Health Service Administration grants. And on each of these, we'll go through the breakdown of what the funding is, because within each of these, there are multiple contracts, and every one of those contracts has specific deliverables and what the funds can and cannot be spent on. We're currently using about 3.3 million of our fund balance in the current budget. This was planned going into this year, and part of that is due to the way the 1115 waiver has been paying, with the portion that pays earlier in the year than the remainder. And then a little over $2 million in other state funding to bring us to the $116.4 million total budget. So this is the budget as of March 31st. Our budget has a tendency to change on about a monthly basis. When the Finance Committee receives the budget, they also receive a list of budget amendments that are over $100,000 for their approval. This is the exact same information, just in a graphical format. Some people like to see it graphically to see the disparity in how the funding comes in throughout the system. And then this is by division. So by division, this is a little further breakdown than what you would typically think of as adult mental health, children's mental health, intellectual and developmental disabilities, and support services. Within the regular mental health, we have broken it out into our homeless outreach and housing, the substance use disorder, because you typically hear now about behavioral health, which is mental health and substance use disorder services, the children's outpatient, the clinics, the residential component, the inpatient beds that are funded, the criminal justice initiatives that are moving forward, and also our capital projects. So within the Health and Human Services Commission revenue portion of the budget, there are three primary categories. Mental health has about 82.4% of that funding from Health and Human Services Commission, substance use disorder just under 6%, and intellectual and developmental disabilities almost 12% of those funds. So this slide is for the mental health funding. The first approximately 5 lines, the general revenue, block grant funds, temporary assistance for needy families, child and adolescent grant, and the mental health block grant children's funds, are all part of our main performance contract, which has specific targets that we need to be able to achieve in serving on an ongoing basis, as well as specific performance measures. There is a set of measures that if we do not achieve, we have up to 10% of that general revenue is at risk of going back to the state if those are not achieved as we move forward. The next section has a few crisis lines: crisis redesign, crisis respite, and crisis inpatient. Those are all designed specifically around crisis services prior to individuals getting into ongoing full levels of care, as you will hear them discuss. A full level of care is once somebody has been authorized for services, meets all the necessary criteria of diagnosis and need and functional impairment, becomes a service package of services that are available to them moving forward that we work with them on to designate a specific plan of care personal to them for building on their strengths and helping them move forward in their recovery. Next, you will see consumer-operated services. On the consumer-operated services, this is basically pass-through funding. We received a contract from the state, so they do not have to go through ongoing procurements. This then is contracted with the Austin area mental health consumers for them to deliver services for the individuals in the community. Outpatient competency restoration provides mental health services, but also helps with addressing the challenges of the legal system that the individual may be involved in, helping them walk through that process. The residency program, we are working with UT Dell Med School in being able to get the residents of their program some real experience in the community mental health system. And that funding comes through the state. Rental assistance is being able to provide a number of months of assistance to help people maintain their housing that they have in the community. The first episode, psychosis, is a team that works with individuals, I forget the exact range, but I believe it's like 18 to 35 primarily, who are in their first occurrence of having a psychotic episode. And they have found through evidence-based practice that really wrapping those services around them during the first episode can help deter further incidents occurring later in life as they move forward. The Healthy Community Collaborative are some funds that we have through the state. We have used some of these funds in the past to help build Terrace at Oak Springs, the 50 individual permanent supportive housing first unit that we have here in the community. These funds are designed around homeless services and helping get people housing as we move forward. The veteran services are some funds to help reach out to veterans and get some specific veteran services on the ground. Mental health first aid are funds supplied for educators to receive training and being able to recognize potential issues with mental health and knowing how to reach out for available resources. Inpatient psychiatric beds, the state supplies some funding that we then contract with some private entities here in the community to have some beds available for individuals that are indigent, that have no other means to have an inpatient bed. And this helps alleviate some of the pressure off of the state hospital system as well. Homeless block grant, this is commonly referred to as PATH, or the, so I forget what PATH is right now. I'll get to it in just a minute. But this is again around homeless services, which we move forward. You'll notice we use acronyms quite a bit in the industry, trying to avoid that as we do these presentations, but that one slipped in on me. Suicide prevention regional expansion. We are working with the state to help train individuals throughout multi-county region on addressing suicide risk and helping prevent that as we move forward. As well as with the Lifeline state expansion, we are one of a few centers in the state that the state is contracting with to receive Lifeline calls. So that is the national suicide prevention number at this point. This will be transitioning into part of the 988 number that you may have read about in the media recently. The Senate Bill 292, this ties in with the criminal justice efforts. This funding is awarded through a grant with the state. This is funding our forensic assertive community treatment team, as well as some housing vouchers, as well as some other supports regarding the criminal justice system as we move forward. House Bill 13 is integrated care in schools, which is providing some counselors and some qualified mental health professionals to provide services in some of the outlying school districts. Post-discharge medications are for individuals that have been discharged from the state hospital or the jail system, and it provides up to a set number of days of medication that are available to those individuals. And then we have been working with CPRIT, or the Cancer Prevention Research Institute of Texas, on taking Texas tobacco free. And there are some funds within our state contract for that. And then the Education Service Center piece of the contract is regarding, we have someone at the Education Service Center for the region. By state law, that individual is allowed to provide general assistance, is not allowed to provide any services, but is able to help train and connect educators with appropriate resources within the community as different needs arise regarding behavioral health issues. So all of those together total up just over $33 million for our mental health funding components. Each one of those has specific outcome targets, measures, and achievements that must be provided in order to maintain the funding. As we move on next in the substance use disorder funds, you will see there is specific funding for treatment of some specific chemicals such as opioid, ambulatory detox. We have some specific for females of certain ages, treatment services for adult screening, comorbid condition services would be individuals who have both mental health and substance use disorder, Suboxone, ambulatory detox, some general treatment services for adults. The funding at the state level has been moving more towards the methadone services, as well as the office-based outpatient treatment, and again, the co-occurring. Where you see the TXMOUD, this is kind of a transition that is occurring at this point. The state has had some contracting issues in the past in getting contracts out and procurements out. So part of their funding, they are now running through some of the universities, from Health and Human Services Commission to the universities, and then the universities is doing the contracts with the centers and with other entities to move the services out. This is through the University of Texas Health Science Center in San Antonio. as they transition some of those substance use disorder contracts to run through them moving forward. The community health worker contract that you see here is for individuals with HIV, since the mental health block grant could not be used since the certain thresholds are not met anymore at the state level for the propensity of AIDS within the community. They shifted that over to a community mental health worker contract. This contract still does those same type of wraparound services with the individuals that are in services for those conditions. And then the final portions of our Health and Human Services contract deal with intellectual and developmental disabilities. So these are individuals that have intellectual disabilities that begin prior to the age of 18. We have some general revenue. There is some permanency planning for how to help maintain the individuals in the community. Community living options information process works with individuals, especially those in nursing homes, helping them understand what kind of options they have if there is the potential for them to move back out into the community. Enhanced community coordination support. The Hub Funds is really a regional educational and support line for helping centers, not only ourselves, but multiple centers in multiple counties, discuss challenging situations and figuring out where there are specific gaps and how to help address those moving forward. And then some crisis intervention and crisis respite funds, as well as a learning collaborative pilot. That pilot is designed around individuals with intellectual and developmental disabilities who are also showing behavioral health issues or mental health or substance use issues, and trying to design some services around them moving forward. So as mentioned, we are very fortunate here to also have multiple funding streams from the city, the county, the healthcare district, and others in the community. One of the reasons that's so important as well, as you can see here on the city of Austin, almost 1.9 million of the 11 million in contracted funds shows as an interlocal agreement, which is local match towards the state contract. So those state contracts that we have with Health and Human Services Commission, the mental health and the intellectual and developmental disability contracts have a certain percentage of match that we have to show from the local community in order to fully draw down those funds. That is what this is for, and you will also see a line similar to this in the county funding as well. We have worked over the last few years in helping move the expanded mobile crisis outreach team out of the 1115 waiver from when it was project-based to when it became overall population-based. And that funding shows here from the city at just over 3.2 million. They have also funded an additional assertive community treatment team. And then you will see a number of initiatives around housing and homeless. With those initiatives, as we move forward, it's just key to keep in mind that some of the services are designed to help get people in housing, and some of the services are designed to wrap around the individuals who are homeless to help them with supports and with their healthcare needs while they are still on the streets awaiting housing. We also have the Ryan White grant with the city, as well as Road to Recovery and the Youth and Family Assessment Center. And you will see down at the bottom, you have the COVID Pro Lodges and the ISOFACs. So those were the isolation facilities for individuals who became COVID positive, as well as the facilities to help individuals isolate themselves from others in the community if, say, they were working in a healthcare setting during the initial stages of COVID and did not want to go home and potentially expose others within their family to any exposure that they may have had to the virus. So those were added during this year, during the interim period with the COVID virus. With the county funding, as we move forward, you will see again the interlocal, which is the match portion for the state contract. The county contracts with us to also provide some claims management for some services in substance abuse as we move forward. So that's what you will see partly as the provider claims and partly as the SAMHSA Family Drug Treatment Court. We also have contracts to provide services at the correctional complex, as well as a wraparound service contract for Family with Voices, which is a pilot that we have been conducting with them to really provide services not only to the child who may be in distress, but to the family and to any conditions from the family that may be contributing to the illness the child may be presenting with. The county is also picking up a portion of the expanded mobile crisis outreach team. We have the Children's Partnership as well as Parenting and Recovery. You will see some additional initiatives with the juvenile probation and community supervision. And also within that substance abuse contract, we have some funding for the medication-assisted treatment program, and also for IDD care coordination, challenging parenting recovery, and some COVID block grant funds that were approved during this last year to help with the transition during the COVID crisis and for some of those support services at the ISOFAX facilities as we move forward. With Central Health and the Community Care Collaborative, they provide a little over $8 million a year in funding for indigent bed capacity. So this would be individuals in a psychiatric crisis who need inpatient care. We contract with local hospitals for this. This, in conjunction with the funds that we have in the state contract, are used to support those admissions that are outside of the state hospital system. And then also $390,000 for a medication-assisted treatment program that was begun to move forward as well. One of the things that we mentioned is in Medicaid and Medicare. These are our primary insurance sources as we move forward. The vast majority is in Medicaid. We have very little Medicare services. The mental health rehabilitation is really skills training and helping individuals learn how to live and determine how to move forward and recover from their illnesses. The intellectual and developmental disability targeted case management is helping them coordinate between all their different types of services and helping monitor the progress that they're making as they're moving forward on services. Where you see mental health, not rehab or targeted case management, those would include all your psychiatric services with the doctor as well as your counseling services. And then the targeted case management would be similar to what it is on IDD targeted case management, helping really tag all their different services together and bring their whole plan of care together. Youth Empowerment Services is a special waiver for children that is funded through Medicaid. We are one provider in that. There are other providers here in the community that we help the interest list come through, be sure they're qualified for the services, and then help transition them to those providers as well. Medicare, as you can see, is only about $450,000 a year. So in relation to the total budget, a very small amount. The Texas Home Living Waiver is for individuals with intellectual and developmental disability services. This is totally state funded, but through a Medicaid program. It does not provide any housing services, but provides some of the other skills training services and support services within the community. The pre-admission screening and resident review process. This is something that was added a few years ago as part of a settlement at the federal level from legislation that a lawsuit that they had with the state regarding ensuring that individuals in nursing homes were appropriate for the level of care and also understood their opportunities for other settings throughout the community. And then you will see at the bottom, we have 2 health homes shown on here. They're shown on Medicaid because these are within our Medicaid contracts. The individuals on these health homes are Medicaid individuals. The first one with Blue Cross Blue Shield is really looking at a special care coordination fee to help ensure that the children on this plan receive their Texas Health Steps as they move forward. The Optum Health Home is a little farther on the value-based payment arrangements. This health home really works with individuals who have been high cost for the health plans. And moving forward, we are trying to help them identify appropriate resources for the individuals, identify particular triggers that may be able to help get individuals into regular community services prior to showing up at an emergency department or needing inpatient care. And with this health home, we have an arrangement with a shared savings based on what we can save them on total cost of care for the individual from prior to being in the health home to what their ongoing cost is moving forward on an annual basis. On the other state funds, this is primarily dealing with the Texas criminal justice system and the Texas Correctional Office on offenders with medical or mental impairment. We have contracts to serve both individuals in the adult and juvenile population. These are individuals who are on probation or parole, who are in the community, who have mental impairments, and thus are eligible for the program. This is a state-funded program. We have a contract with the Cancer Prevention and Research Institute of Texas that will be advancing forward in this next year as we look at expanding that education on taking Texas tobacco-free and offering support to some of the federally qualified health centers moving forward on educating their clientele regarding that initiative. And then we have the 1115 waiver and other federal funds. The 1115 waiver you will see here shows $16.4 million in potential revenue during this year. In addition to that, we have some carry forward that we are including from the fund balance. In total, we get about $19 million a year in the waiver funding. Mental health first aid, we have some local grants to help support that initiative as we move forward. You will see a number of SAMHSA or Substance Abuse and Mental Health Services Administration grants. One of these is regarding reaching out to veterans and military personnel and their families. Another one is around expanding assisted outpatient treatment. The clinical high-risk psychosis is like the first episode psychosis program. And then we also have a contract with Del Valle ISD for victims of criminal activity. So that's providing basic mental health services, but we have to be able to tie in some way, shape, or form how they have been impacted by criminal activity during their lifetime. And then we are working with the SAMHSA grant also through the University of Texas Dell Medical School. In addition to all those primary funding sources, we have a number of other funding sources. I'm not going to read through all of these for you, as I want to save some time to go through the transition we'll be going through this next year in some of our funding streams. But as you can see, primarily we do serve an indigent population. There's only about $540,000 of our total budget that comes in from client revenue throughout the year. And that is due to maintaining a sliding fee scale as required by our state contracts. On the expense side, you will see that primarily our expenses, as you would expect with any health and human services oriented organization, deals with salary and fringe benefits at almost 62% of our budget, and then contracts and consultants. So between those two, we have over 80% of our budget accounted for. Another 6% in facilities and insurance, just over 4% in capital outlay, and other minor percentages. You will see prescription drugs and medicine is fairly low at 0.61%. This is primarily due to, with the large number of indigent individuals who receive care, we are able to help them access the patient assistance programs through the pharmaceutical companies, which then offers them free medication that is prescribed for them to help with their conditions. This is the same information, just broken out in a graphical format. It just really emphasizes again how much of our budget is tied up in salaries and fringes and also in contracts or consultants. So primarily in those support pieces for direct support for the services that we provide. Wanted to go next fairly quickly through the strategic plan overview for fiscal year 20 to 22. Just a reminder, our vision is healthy living for everyone, and our mission is to help improve the lives of people affected by behavioral health and developmental and/or intellectual challenges. The primary value areas that we have include people, first and foremost, integrity, excellence, leadership, and transparency. Transparency becomes fairly obvious as you see the level of detail we are providing regarding the contracts that we have. So now these are a little bit updated. We have recently, as we've been working on racial equity as we move forward, done some tweaks and updates to our strategic plan. Still have the same primary areas, the first one being around ensuring operational excellence, sustainability, value, and equity. And I won't read all these to you. I'll just give you a couple minutes on each slide so you can glance through and see how we have broken those down. And within each of these areas, we have many numerous initiatives within the organization that we address and we have in a business plan that we update the board with on a quarterly basis. So this one is on innovation, and it's embracing effective models of care to ensure equity, access, value, and quality. And then the third area is on communicate, collaborate, and connect. And it's enhancing public trust and collaborations to address the needs of all communities. So all of these areas of the strategic plan will be kept in mind as we move forward on the budget for fiscal year 2022. I will tell you this is a very unique period of time in financing in behavioral health services as we move forward. One of the primary challenges that we had initially was looking at the transition of the 1115 waiver. I'll go into this in a little more detail. One, I do want to thank the Integral Care Board for all their foresight in reserving some funds from prior years of the waiver, since we knew that the waiver funding for the final year was being reduced to 80%. They reserved enough funds from the previous years that we have received in order to keep that fairly stable moving into next year. With that, the Delivery System Reform Incentive Payment Program that is part of the waiver will end as of September 30th. With that, we will receive the final payments from that program in January and July. So those are the payments that are reflected on this slide here that help us keep that 1115 funding for this next year still consistent at around 19 million. A lot of you have probably seen in the media about the 1115 waiver itself, where the Center for Medicaid Services had initially approved a plan for a waiver extension through September 30th of 2030. They have since pulled that renewal back based on the change in administration and determining that they thought there should have been a public comment period when the prior administration had waived the public comment period. There is currently a lawsuit in process that is working on that as we move forward, as well as the state has reapplied for the extension in order to help alleviate the concerns regarding the public comment period at the federal level. They are currently in the state public comment period on that re-request for the renewal. I will go over what was included in that renewal that would impact the mental health systems here in the community. First is a directed payment program for behavioral health services for individuals in STAR, STAR Plus, and STAR Kids, which is basically the Medicaid managed care here in Texas. This program will be moving forward even prior to the renewal or extension of the waiver. It is waiting final CMS approval, but the waiver calculates based on budget neutrality to the state and federal government. And they still have, enough room in the current waiver for this program to move forward. For integral care, this has the potential of approximately $5 million in funding for this next fiscal year. And what it's really trying to address is the cost of services compared to the Medicaid reimbursement rates. So you can see there is a significant gap between the reimbursement rates that we receive from Medicaid and the actual cost of service provision itself. The other program that was included in the waiver extension that impacts our services moving forward is it included a public health care provider charity care pool. This was designed to allow for a federal portion of funding for indigent individuals who are receiving services. So currently, all of that happens through our general revenue with the state, as well as through the 1115 waiver, as well as through other funding sources with other community collaborators. This would allow for us to do a cost report after the fiscal year was over to try to pull down federal funds to cover a portion of those costs moving forward to make those more sustainable. If any of you are familiar with the hospital systems, this is similar to the charity care programs or uncompensated care programs that they have in the hospital systems. This on a statewide basis was set at $500 million a year. It includes all of the community mental health centers, as well as the local behavioral health authorities, as well as the public healthcare districts, which was basically based on what their district valuation was in the year prior to district ending. So we are hopeful that this will get resolved moving forward and that this will still come into play. This will not impact our income until fiscal year 23, even if it does go back into play as of October 1st, because we would not be able to file the cost report for reimbursement until after the year was complete. Other financing changes that are happening in the system right now, there's the Coronavirus Response and Relief Supplemental Appropriations, or House Resolution 133. At the statewide level, Health and Human Services Commission is receiving another $74.6 million in mental health block grant and $135 million in substance abuse prevention and treatment block grant. They are allowed to use these funds between March 15th of 2021 and March 14th of 2023. If they need more time, they can extend it by 1 year, but without adding any additional funds to those terms. In looking at this funding, the state went to their statewide behavioral health strategic plan and decided to work on a few of the gaps that they have identified in their strategic plan, which was access to appropriate behavioral health services, access to timely treatment, use of peer services, prevention and early intervention services, access to housing, and service for special populations. They also reviewed, excuse me, there have been initiatives going on Senate Bill 633, which is now called All Texas Access, which was primarily looking at gaps in services in the more rural and frontier areas of the state. And they reviewed that during their design as well. With that, they came up with these 7 strategies that they have proposed to SAMHSA for using the mental health block grant. Some of those that are in blue are really areas that we have been notified of some potential funding. So state hospitals stepped down to the community. They have talked to us about a program of Bridge to Start Plus for individuals that have been in nursing homes or in the state hospital or state supported living center for extended periods of time to try to provide appropriate supports to be able to help them live within the community. Around that, they would also contract with the managed care organizations directly for appropriate nursing services until the individual could get their Medicaid eligibility back. For us, that's about $195,000 a year in staffing costs that would incorporate. On issues to address housing instability and homelessness, they are looking at about $3.3 million a year. Again, this would be for an 18-month period. For each of the current Healthy Community Collaborative sites, this would help with rental subsidies, furnishings, utility assistance, as well as providing supported housing services, peer support, primary care services, and also helping individuals gain access to appropriate Social Security benefits. Another area that they reached out to us, and this would be with all the community centers in the state, is regarding mental health outpatient capacity for youth and adults. This will be kind of formula driven, will increase the number that we need to serve above our current targets. And it's estimated that this will bring in about $1 million a year towards additional services. And then they also have requested that we look at increasing another team for first episode psychosis, as we have found success with this program moving forward and have additional individuals who could benefit from it. That would be about $453,000 a year in staffing costs. One thing to be aware of on this coordinated specialty care program, there are, based on evidence-based practices, specific caseload limits that we are not allowed to go above, which is why they need to fund a full team at a time as we move forward. And then just yesterday, we were informed that the consumer operated services portion of the contract that we have would have an additional $66,000 for next year coming into it, which that will be transferred over to the Austin area mental health consumers, and we will be working with them on a plan as to how to proceed with those funds and track those funds moving forward. On all these funds, we have to track them separately from the regular contract funds so that we can show the specific number of individuals served and the outcomes for those individuals moving forward. In addition, they received some substance abuse block grant funds. These are some of the areas that they were looking at on the substance use. We will see minimal changes in our substance use contracts from what we have heard so far. As that moves forward with the House Resolution 133, there is also the current American Rescue Plan Act of 2021 that was passed, which adds additional funding that has to be used by September 30th of 2025. You will see the mental health block grant funding for this is more than it was under House Resolution 133. These are again at the statewide level. And the substance abuse prevention and treatment block grant is a little less than it was in the initial allocation under House Resolution 133. In speaking with the state, their initial proposal is looking at being able to keep in place the funding that they're doing with House Resolution 133 and extending that to September 30th of 25. And then any funds that are left over from that, they will be determining how to appropriately utilize moving forward. I will say from the federal level, there has been a lot of emphasis on crisis services moving forward. So I would anticipate that they will be looking for some strategies around crisis services as we look at any unutilized funds there. Just some global things as we look forward to the budget process moving forward. Integral Care has been doing quite a bit of work as far as reviewing the budget through the racial equity lens and looking at racial equity across the agency and how to make it a collaborative and embedded portion of the agency. One of the things in the budget, we'll be looking at establishing an Office of Racial Equity. So we have a central point for monitoring and tracking and holding ourselves accountable for racial equity as we move forward. We'll also be working on how to identify and reach the underserved areas of the community. We'll have a planning initiative going on with outside consultants as well to get the community feedback so people feel more comfortable in telling us their true feelings about how things are going and how things need to move forward. And then looking to see, do we need to look at doing some mobile clinics? Do we need to look at doing some smaller clinics in multiple areas within the community to help people reach services that they may need? Looking at different models such as the Promotoria model, where we work with trusted advisors within the community and how can they help really work on bridging that gap between the services and the individuals in the community, or helping us adapt the services so that they speak more to the individuals in certain segments of the community. With all the different funding coming down the line and each having its own set criteria, it's going to be very challenging in identifying and acquiring the appropriate workforce. I'm sure you've already seen multiple articles in the paper about workforce challenges in individuals hiring, even in the service industry for restaurants and grocery stores. We'll need to deal with the anxiety individuals may have regarding COVID and returning back to the office space, even market challenges as nurses become more and more needed within the community. And if we need to adjust certain rates in nursing services and crisis services for pay as we move forward. Again, time-limited funding streams. Most of the Substance Abuse and Mental Health Services Administration grants that we receive are usually for 2, 3, or 4-year periods. So when we're on a grant-funded system of care, all those grants are very time-limited, and we have to figure out how to sustain those services moving forward, which is typically challenging in a situation where the primary individuals you are serving are indigent and do not have health insurance that covers the cost of those services. While we see some hope in having the Coronavirus Response Relief Funds and the American Rescue Plan funds hold out through September 2025, we need to start planning now for when that day arrives and how we will continue sustaining some of those services as we move forward. Part of that solution is continuing to look at value-based and alternate-based payment models that aren't necessarily driven based on the volume of services that individuals receive, but can be driven based on outcomes or sharing cost savings that we're bringing to the total cost of care as we move forward. But also recognizing that the challenge that a lot of those value-based measurements are currently built on face-to-face visits, and helping adapt those models and those standards as we move forward, since there will be the mixed modality of face-to-face telehealth through video or telephone contacts moving forward, and trying to balance all those service modalities out with what's best for the individual that's receiving the service. Some people really like the telephone and the telehealth. Some really need the face-to-face visits. It's just going to depend on the individual that's being served. The state is about to go out for managed care procurements again. As they go out for managed care procurements, if they change the managed care organizations for Medicaid within this Travis service region, that will change a lot of our contracts and start us over on some of those value-based and alternate-based payment models. Through a federal initiative, the state is moving forward gradually on electronic visit verification. This is something we have to keep in mind as people do more and more services in the homes. More and more of those are becoming subject to what they're calling EVV, or electronic visit verification, where through cell phones or other means they're tracking to show that the individual providing the service was at that location during that specific time. That has to match what's on the billing, or else the billing will be denied. And you're only allowed to have a certain percentage of those that don't match exactly, or else you start having funds being recouped from you and having more claims denied. On the expense side, we have our health insurance increase. We have had a lot of utilization over the last few years. Overall, for the current staff of employees, our health insurance will be going up by about $1.6 million. In the current environment, we have tried to buffer as much as we can the employees from absorbing that cost. So of that 1.6 million, about 1.5 million will need to be absorbed by integral care moving forward. The other 100,000 will happen from the employees. Most of that is helping cover part of the coverage of their dependents. And then we have the American Founders Building up just off of I-35 near St. John's, which we will be getting out for bid and doing renovation on during this next year. We have the challenges right now, as you see in the paper. Some of the construction costs are starting to escalate exponentially right now, and trying to work out that construction process, renovation process on the interior with the timing of the transition of our leases in the current facilities. So I know that was all pretty quick. A lot of information to absorb. Lady Jane, do we have any questions at this point?
Yes, we do. Lisa?
Hi, right now there are 5 questions, and I'm going to read them in the order that they came in. The first one says, can there be a clearer breakdown on SB 292, FACT, housing vouchers, and quote, other services related to the criminal justice system, unquote? What are those services?
I don't have it with me right now, but we can get that to the individual who asked the question and send it out to him.
Okay, great. The second question, are the Medicare funds reimbursed? Are the Medicare funds reimbursed claims, question mark, and then FFS, question mark?
Yes, so the Medicare funds that show there are for individual claims, and the FFS stands for fee for service. So those are based on individual visits that the individual has with appropriate practitioners.
Okay. The third question, how many people receiving raised services, and what is the waiting list / number not being able to be served that would qualify?
And I will need to pull those numbers and we can send that to the individual.
Okay. Will the budget and strategic plan be sent out post this meeting?
So I would think that we could send this presentation to everybody that signed up for the meeting.
And so far, the last question, another one just came in. Some positions such as QMHP only get raises every 2 years. Are there plans to change this as cost of living continues to increase?
So one of the big challenges that we have as a governmental system, and as having our funding coming in through contracts, the only way, except when new funding is coming into the system without additional contract requirements for us to adjust salaries, is basically to eliminate positions. So that does become a challenge as we continue to move forward. That is why we are trying to target some specific areas with some of that directed payment program for behavioral health services, since those funds do not increase the targets that we have to serve at the same time. But there is not a plan or a way for us to change the funding to have ongoing cost of living increases.
Do we have an estimate of staff turnover rates and how much is spent on hiring / onboarding?
I'll have to reach out to Human Resources to get that information broken out.
Is it a priority to have clients apply for Social Security benefits?
So one of the priorities for clients applying for Social Security benefits is to help them get funds to maintain their stable housing as they move forward, or to provide them other supports within the community so that they have some ongoing income. We have a program called SOAR, which helps with that as they move forward. Typically, we have had over a 40% success rate of the applications that are turned in helping them get the benefits as they move forward.
And this is currently the last question. Will the Founder Building be ready in FY 2022?
So it will be ready sometime during fiscal year 2022. We have run into some challenges as we've been doing the design. The design is pretty well done at this point. The initial plans have been submitted to the city. The city has changed their processes some, so we can't run the 2 reviews with the city simultaneously, which will add another month to the timeline. Once we get the approvals back from the city on the plans, we will put it out for bid with the contractors. And then after the contract is finalized with a general contractor, it's estimated that it will be about another 7 months before the renovations will be complete.
And we just had another question pop up. Are you looking at how to refer clients to apply for Social Security? SOAR applies only to those that are homeless or HUD defined homeless.
Yeah, so where we can, we are trying to assist, and part of this is part of the case management process as well, in helping individuals apply for benefits that they may be eligible for, whether that is Social Security or something else. Also for individuals who may qualify for Medicaid, helping them through that process. Texas is unique in that Medicaid eligibility is not strictly income contingent, but also requires proof of disability. So that does become a challenge as we move forward as well.
And another question, in preparing the budget, did Integral Care track / account for the number of clients whose services were terminated for, quote, refusal to engage?
Yeah, so that's not a tracked number as we're working on the budget. It is always a challenge as we move forward on balancing trying to engage individuals with services with also balancing their right to refuse services if they do not wish to receive them.
Okay. Are you now asking your case management employees to file claims for Social Security?
No, we are not asking our case management employees to file claims for Social Security.
And that was the last question.
Okay. Well, I would like to thank everybody for your time and attention. Hope this was helpful and gave you some meaningful information. I would also encourage you at your convenience, if you ever need to see some fiscal information on the Integral Care homepage, I believe it's under Who We Are, you can get to a financial page that gives you all the detail of where we are year to date on our financials, as well as our latest audit report. Our grants report is what we're applying for in grants, and other financial information for the organization. Thank you very much.